Welcome to TEMSIS Tips with Todd. Today I'd like to talk about the difference between primary symptom and provider's primary impression. I'm often asked, what is the difference between the two? And the best way I can describe it is primary symptom is exactly that. In this case, it's the primary symptom of this patient, or the most dire symptom of this patient that we're talking about, is breathing problem. Then as we go to Assessment tab, and we look at the primary impression of the provider, I chose allergic reaction. So the primary impression generally goes along with what I'm treating the patient for, my differential diagnosis, if you will. So I'm going to judge all my treatment based on my primary impression, which I believe the reason why he's having difficulty breathing is because he's having an allergic reaction. Another good example of the difference between primary symptom and primary impression is, let's say that this patient has cut their finger off in a log splitting injury. Their primary symptom, I would probably imagine, would be pain. And if we click over to assessment, why are they having the pain? Well, their primary impression is the traumatic injury. That's also what I'm going to treat them for, is a traumatic injury. So that is the primary difference between the primary symptom and the primary impression. The best way I remember how to use the primary impression is just to think, okay, my primary impression is what I'm going to treat them for. So in our last example, where we used breathing difficulty, I'm not going to treat them for the breathing difficulty as much as I was going to treat them for the anaphylaxis. So I hope that helps. If you have any questions, please contact me at the Bureau of EMS, and I can answer any questions for you. Thanks for listening to TEMSIS Tips with Todd.